Now, your health, your safety. This is ABC7 News.
Hi there, I'm Kristen Z. Welcome to our daily special called Getting Answers. We're asking experts your question every day at 3 to get answers for you in real time. Today we have two experts, one expert on travel, the other on pets. And we'll cover all your questions about COVID-19 and your pets coming up. So post your questions on our Facebook live stream, YouTube Live, or check out our Instagram stories to submit a question. But first, let's recap what Governor Gavin Newsom says is now allowed in the state, as long as you maintain 6 feet and gather with only members of your own household. So take a look. The list is non-exhaustive and starts with athletics. That is a little vague, but sports like tennis are not explicitly listed, so we have to infer that tennis is covered under athletics, but that is a little bit open to interpretation. But remember, between state and the county, the stricter order still applies. So for example, San Francisco still has tennis banned, so we assume that means no tennis in San Francisco. But Coco County, Contra Costa, allows tennis. The list also continues with some things such as golf, singles, so I guess playing by yourself, not in a foursome. Walking, okay. By the way, golf with no carts. But take a look, table tennis is allowed in the form of singles, but again, that means you're 9 feet away, because that's how long a ping pong table is away from your opponent. Volleyball singles, so I'm not sure if that means one person on each side of the volleyball net, how that works, but take a look at that. Some of that is still a bit confusing to folks, so hopefully we'll get more clarity still from the state and the counties in the days ahead. But now that you're caught up there, let's talk about your pets and their health. As you might have heard, some dogs and cats have now tested positive for coronavirus. So today we want to explore what that means for your pet and your health. Joining us is the Chief Veterinary Medical Officer for UC Davis, Dr. Jane Sykes. Dr. Sykes, thanks for joining us today.
Thanks, Kristen.
I don't want to overblow this, so you give us the facts, the actual numbers. How many cases of COVID infections do we actually know about for sure among dogs and cats and other family pets?
Okay, so worldwide, there's really just a very small number of cases known. So the first case was the Pomeranian in Hong Kong, and that dog was in contact with someone with COVID-19, and it was a 17-year-old dog that didn't have any signs of illness but tested positive repeatedly. Unfortunately, that dog died suddenly after it was released from quarantine, probably from other reasons. And then we've also had another dog in Hong Kong that was quarantined, a German Shepherd that tested positive with no signs, and a cat in Hong Kong with no signs. And the first case of a cat with signs came from Belgium, and that was a cat that was living with a woman who had returned from Italy and developed COVID-19. And her cat then subsequently broke with signs of respiratory distress and vomiting and diarrhea, and tested repeatedly positive for SARS coronavirus 2. So that cat was quarantined, and we didn't have much follow-up on the outcome for that cat. So subsequently, we've had 2 cats now in New York with mild respiratory signs from 2 different households. One was known to be in contact with someone with COVID-19, and the other was presumed to be infected as a result of asymptomatic transmission from a person. And now we have this dog, Winston, the pug in North Carolina, that's also developed mild respiratory signs and concurrently tested positive. But I should say that we've also know that there's thousands of animals, more than 6,000 animals that veterinary diagnostic labs have now tested since the middle of February. So very, very large numbers of animals in heavily impacted areas that have all tested negative. So it does need to be kept in perspective.
Okay, we're getting a question in from Robin Langston on Facebook, wondering how did they test those animals and what prompted the animals to be tested? I'm sure the cases are different, but are you seeing a connection?
Yeah, it's a little bit different, the circumstances. So in Hong Kong, they were routinely quarantining animals, companion animals that were in contact with people with COVID-19 and testing them just to see if they got infected. The cat from Belgium was sick, obviously had developed illness after being in contact with someone with COVID-19 and therefore was sampled because of concern that it could have COVID-19. And then the two cats here, again, were tested as part of initial surveillance efforts as well, and then confirmed. And these large diagnostic laboratories, they have been just testing using tests developed specifically for animals, not the human tests, to try to understand the extent of disease in companion animals. And that pug in North Carolina was part of a study at Duke University where they were also doing surveillance.
So Elizabeth Estrada wants to know which breeds can get the virus. And I know you've listed a few different ones there, German Shepherd, Pug. Are you seeing any trends emerge as to which breed might be especially susceptible or no?
Yeah, there's just so few cases now. It's very difficult to determine whether there's any sort of breed susceptibility. So, we've got a smattering of different breeds, and there's been some experimental infection studies, but no one's really looked at differences between breeds. Actually, there was a lot of sentiment that cats might be more susceptible than dogs based on some of the limited experimental infection studies done and the early recognition of a cat with clinical signs, as well as the big cats at the Bronx Zoo. But really, again, we have so few numbers of animals that are affected that you really can't make an assumption about whether cats or dogs are more susceptible or one breed or another is more susceptible.
Right. Now, you mentioned a few that might have gotten it from their humans. Is there any sign that any of the animals might have also given it to their humans?
Yeah, so that's been a big question. And right now we have absolutely no evidence that pets can transmit this infection either to other pets in the household or back to people. And so overwhelmingly, public health officials are repeatedly emphasizing that this disease is spread by human to human transmission, and you're not likely to get it from a pet. So people shouldn't be concerned that pets are a significant source of infection. There's been no evidence in the real world that dogs and cats can transmit it onto other animals.
All right, can we talk about their symptoms? I know you mentioned respiratory symptoms in some of these animals, but do their symptoms and the progression of the disease in them tend to be the same or similar to what happens to humans?
Yeah, again, so now we've only actually got 4 pets that have had signs, and we haven't always been able to prove that those signs are truly due to SARS coronavirus 2, because it's possible that they could have had some other dog or cat disease and just happened to also test positive. So we still can't even prove that SARS coronavirus 2 causes illness in pets. However, the signs that the pets have been showing are quite similar to what's been reported in people. So in the case of the pug, it's sort of cough and gagging, what we see actually with a common dog disease called kennel cough. And that dog also didn't really want to eat very well, very briefly. And then the cats also had signs of, mild respiratory illness, so cough, slightly increased breathing rate, those types of signs. And then there was the cat in Belgium that had vomiting and diarrhea. So those are signs that have been described for people that have COVID-19. Again, whether they were truly caused by the virus or not, we're not still 100% sure. The big cats at the zoo also all did have respiratory signs too. So coughing, respiratory disease, and that also aligns with what we see in people.
All right. I'm glad you touched on the symptoms. When we come back, we'll talk about how to treat a perhaps sick dog or cat, whether it's to isolate or take them to the vet. So we'll talk about that when we come back. And we're going to take a short break on air, but we can continue the conversation over on our live stream platforms. And we'll also have Dr. Alok Patel about the new drug that the FDA is fast tracking later on in the show.
We are in commercial break.
Okay. Dr. Sykes, I want to ask you a question that I'm seeing from Stacy Lamb, which is, what is the treatment? Actually, let's hold on to that because I feel like that's relevant to a lot of people might want to know about that. So Robin is saying, my dog has had a cough and loss of appetite, some fever. You would not suggest, or would you suggest, if you see that in your dog, rushing them to the vet? Would you do that?
Yeah, so what we would normally recommend is, first of all, people need to understand that those signs are much more likely to be due to a dog or a cat common disease than from COVID-19. And they should do what they would normally do, which is to call their veterinarian and talk about it with them over the telephone, determine whether the animal needs to be seen at the practice. Some vets are doing telemedicine consultations, for example, that they could do if they were a regular patient of that hospital. And then they would decide whether to bring the animal in. And if the animal had been from a household where there was known COVID-19, then they would handle that animal with precautions, and they would ask that somebody else brings the animal to the veterinary clinic, obviously not the quarantined person.
Ah, got it. Okay. Are you guys doing a lot of telemedicine appointments?
We are doing a little bit for pre-existing clients, yes, and we're also doing telemedicine consultations for our referring veterinarians.
Okay. All right. How much time do we have before we come back on air?
30 seconds.
30 seconds. Okay. So we'll just take our question back on air. So hold on tight, folks.
We are back in 15, 10, 9, 8, 7, 6, 5, 4, 3.
And we are back with the Chief Veterinary Medical Officer for UC Davis, Dr. Jane Sykes. We left it off at, what to do if you do have a sick dog or cat. Should you seek a vet's assistance? Should you just kind of quarantine them? What's your advice?
Yeah, so there's two different situations. If you are in a household that has COVID-19 versus if you're a healthy person that's just with a pet that develops illness. And in both situations, you should remember that it's more likely that the cat's illness is not COVID-19, that it's some other dog or cat disease that's a lot more common. But you should call your veterinarian. If you're in a household and someone in the household has COVID-19, then we recommend that pets be quarantined with those people. But if they did develop signs of illness and need to be seen by a veterinarian, then someone else, not the quarantined person, should take that animal to the vet. And obviously calling the vet before, there might be the possibility of having a telemedicine appointment beforehand that could be done remotely to talk about what's going on and whether the animal really needs to be seen or if it can be managed at home.
All right, Tia Hamilton has a really good question. She says, I wash my dog's paws after walking twice a day because of the virus on the sidewalks. Also, I was told that the virus can live on their fur. Is that true? So washing the paws, good idea, and can it live on in their furs?
Yeah, so there's also, just like I said, there's been no evidence of transmission of infection from dogs and cats as shedders of the virus. There's also been no evidence of transmission from dogs or cats as being contaminated with the virus. No one's actually studied survival of the virus on pet hair, but it probably behaves a little bit like cardboard, so wouldn't survive much longer than a few hours on pet fur. I think the main thing is if you're out walking your dog, the biggest risk to you is not the dog getting contaminated from the environment, but getting too close to a person on the street. And so long as you're physical distancing while you're out walking your dog, that's the main thing. So people are concerned about going up to other people's dogs and maybe patting them and then getting infection from the dog. No, the bigger risk is actually the person on the other end of the leash.
Okay. So what are the best practices with your pets? I imagine the advice for dogs and cats pretty different because it's easier to keep your cat indoors, but not so much with your dogs, right? So what are the best practices?
Yeah, so the best practices are to keep cats indoors if at all possible. And then if you're out walking your dog, make sure that you walk it on a short leash, not one of the long extendable leashes that could take it more than 6 feet away from you. So leash your dog when walking it. And then if you are sick or suspected to have COVID-19, your pet should stay in the household with you and not leave the house.
What about advice for folks who have animals who are, emotional support animals, seeing eye dogs, for example? In that case, it is so much harder to separate the human from the pet.
Yeah, so, and again, I think it's really worth remembering that the pet is not a significant source of infection, and it's quite unlikely that pets are going to get it from people. And so people who are known to have COVID-19 or highly suspected to have it, if they are in a household with their pet and they need to have close contact with them, then they should be wearing a mask in an attempt just to protect the pet, to be on the safe side. So that's been recommended by the CDC as well. And others that are in the household interacting with the pet, should also be wearing face protection and a mask should there be a slight risk that that pet could transmit infection back to people, because we don't know for sure that they can't at this time. But again, overwhelmingly, this is a human-to-human transmitted disease rather than a dog or cat-to-human transmitted disease.
All right, Dr. Sykes, I think your insight has put a lot of pet owners' minds at ease. Thank you so much for that useful information. Thanks for joining us. All right, when we come back on air, we'll talk with a local travel expert traveling during this pandemic, and we'll also hear from Dr. Alok Patel about the new drug that the FDA is fast-tracking to treat COVID-19. Is the hype real? We'll be right back.
And we're in commercial break.
All right. Thanks for joining us today. It's been really interesting to hear that angle, because I think a lot of people, when they heard about the North Carolina dog that was diagnosed with COVID-19, started to really have a lot of worries about their pets, transmission this way versus that way, and how to protect their pets. So hopefully we all understand it is a very small number of confirmed cases in dogs and in cats, although it has happened both here in the U.S. and also in Asia and Europe. So we'll keep an eye on that. And in the meantime, we're connecting with our next guest, who is a travel industry expert, because I'm sure you've heard about some of the actions that the airlines are taking to protect both their crew and their travelers, passengers. All right, so hey, Chris McGinnis, how you doing today?
I'm great. How are you doing?
Good. All right, I'm psyched for this conversation.
1 minute.
What was that, Eric? Yep, okay. And how much time do we have for this chat? We have about 7 minutes. 7 minutes to say everything there is to say about the industry, and also which airline stocks to pick. No, I'm just kidding, Chris. I won't put you on the spot like that.
Don't make me do that.
Yeah, that is going to be a tough one. All right. Can we do a story? Yes, absolutely. Okay. Great. Have you checked out some of the, or were you the one who wrote about some of the new configurations that they're considering for seats? Like the middle seat turned around? Okay, we can talk about that as well.
Yeah, there's a little bit of the brand new news that we have. I'm not sure if your producer told you or not, but American and Delta have joined JetBlue today, and they're requiring passengers to wear masks on the flights.
Okay, we're coming back on TV, so.
3, 2, 1.
Welcome back. A lot has changed this week when it comes to traveling and specifically flying. Some airlines are trying to suspend some service and have, but other airlines are requiring and providing face masks now and coverings to passengers. And a lot of questions remain about the future of flying. So here with us is senior travel correspondent from SF Gate, Chris McGinnis, to try to unpack it all. How's it going, Chris?
I'm doing pretty good.
I'm glad you joined us, because this week we are seeing some moves by the airlines to protect not just their crew, but also passengers. So JetBlue was first. But talk about which airlines are now mandating masks for the crew and which ones are also mandating masks for the passengers.
Yeah. Well, in short, I think that all airlines are in short order going to require that passengers and crew wear face masks. JetBlue started this off this week by being the first U.S. carrier to require both passengers and crew to wear them. Frontier Airlines followed, and then just today, I've gotten word from Delta and from American that they too will require that passengers wear face masks when they are at the airport, when they're on the plane, and when they are getting off the plane. Most of these requirements go into effect the first week in May. As you know, not very many people are flying right now. We're down to about 100,000 Americans per week are flying, which is down about 95%. So this news really doesn't mean much to anybody until we start flying again, which will hopefully be sometime soon. But I don't expect it's going to pick up strongly until toward the end of this year.
Well, yeah, I mean, a lot of people are sitting on their summer plans right now, and what they really want to know is, would it be safe to fly? Like, are the airlines, for example, cleaning well enough? What are they doing to sanitize? Is the air clean? Are those some things that you can talk about, whether you feel like they're providing a safer, cleaner environment to fly for those who either want to or need to?
Yeah, well, I mean, I don't think a lot of consumers are going to be ready to jump on board probably until we have a really good fix for COVID-19, whether we get a very good therapeutic or a vaccine. So the people that do will be taking a risk, and not that many people want to take risks, especially when, if it's a family vacation or something like that. It's like, I just don't know if I'm really ready to jump on board yet. But the airlines are coming out with a lot of statements about what they're doing to clean planes. They've all bought these new electrostatic guns that spray disinfectant, on all surfaces of the plane. They're showing videos of them wiping down everything in sight. They have restricted interaction between flight attendants and passengers. So food service is minimal at best. I mean, you're handed a wrapped snack and a bottle of water, and that's about as good as it's going to get. Even if you're flying in business class, I don't think we're going to have, elaborate food service for quite a while until we see, some changes medically and how we're battling with the virus.
Mm-hmm. Are there changes to the design or the configuration of the seats? I saw some articles, maybe even one done by you, in which there's a design now where you flip the middle seat so that it's facing in the other direction to avoid this kind of air-to-air thing where you cough on somebody. Can you talk about whether industries and airlines are actually starting to do that? And then, I also heard some airlines are just not booking the middle seats. Tell us about that.
Yeah, well, what most passengers are going to see in the near term is that airlines are not booking middle seats. Planes are going to be about a third of the seats are not going to be sold. The story that you're talking about that we wrote about on SF Gate was it was sort of a proposal floated by a seat or airplane interior designer, where they proposed that they were seats that had sort of a shell, like plexiglass shells around them to prevent you from having, much interaction with your neighbor. They also had seats with that configuration. They had forward and rear facing seats. It's sort of hard for me to describe without having a good visual of it, but that's a great idea. It's also the same company that came up with something called a saddle seat earlier or last year that people kind of wondered whether or not they were actually going to do that. So they come up with these designs. Whether or not they become reality is quite a ways off. So I think in the near term, we are going to see airlines not selling that middle row of seats. And I think that going forward, that's what we're going to see until social distancing guidelines are relaxed.
All right, Dahlia has a good question, which is, when we do eat or drink on the plane, how long can we remove those masks for? And if you're going to remove the mask to eat and drink, then isn't it not effective?
Right. Well, I mean, that all has to be hammered out by the airlines. I'm sure that people will be able to remove them momentarily in order to eat or drink. But as I said before, eating and drinking on board planes is not going to be an elaborate thing and not a very common thing until until we have the coronavirus beat and we're back to flying like we used to with full planes and full food service.
Hey, are there exemptions for the airlines that have adopted the passenger mask rule? Are there exemptions for children, for example, or other categories of people?
Not that I've seen right offhand. I would imagine that as these new rules roll out, that there will be exceptions. Probably I would imagine for children. But as we all know, the mask is not really there to protect the passenger or the child. It's there to protect everyone else around us. So when you put a mask on, you're putting a barrier between you and everybody else around you in case you cough or sneeze.
All right, Chris McGinnis, great chatting with you. Thanks for your insights on the airline industry. We'll keep this conversation going sometime. Take care.
All right.
All right, up next, we have Doctor's Note with Dr. Alok Patel. You heard about that new drug made by Bay Area's Gilead that could help treat COVID-19. They say why it's become a roller coaster ride. Remember, we do take breaks on the air, but the conversation, of course, continues online right now. In fact, if we have time, in commercial break, we can talk to Chris more, right? Chris, are you still there? Let's get another question now, and this one was really for me because, the airlines are getting government help, but they've also sent out furlough notices, pay cuts and revenue warnings, and Boeing as well. So where is the industry headed? I mean, do you think it's going to come back? And if so, how different is it going to be for those of us who fly when it does come back?
I think that we're probably going to see a much, much smaller airline industry over the next 2 years as the airlines start to crawl out of this. It's going to be a very slow go. We're not going to jump back into this, and we won't jump back to it in a big way until we see a vaccine or a good therapeutic that makes people more confident to be in enclosed spaces with others. So a very slow go. I don't expect a lot of, if any, international travel this year. A little bit of domestic travel next year will probably start to come out of this, and by 2 or 3 years from now, hopefully, according to the experts, we should have a vaccine by then, and we can maybe start thinking about getting back to where we were in 2019.
Yeah. All right, Chris, thank you so much. We are coming back on air in 30 seconds, so I'll say goodbye and thanks again.
Right.
Take care.
Thank you.
All right, folks, when we come back on air, we're going to show you our doctor's note. All right. Oh, wait. I can't. There's a chair in the way. Okay. See, doctor note.
8, 7, 6, 5, 4, 3.
We are now able to bring you even more content now that we have this new platform at 3 o'clock every weekday. That means we get more from our special correspondent, Dr. Alok Patel. He's part of our coronavirus team of experts, and he's talking directly to you in a segment we're calling Doctor's Note.
Headlines about the antiviral drug remdesivir are a scientific emotional roller coaster. There's good news, and there's bad news, and there's uncertain news, and then all of a sudden there's all this talk of Gilead's stock price going up. I'm Dr. Alok Patel, and let's get into it on today's Doctor's Note. Remdesivir is an antiviral drug made by Gilead Sciences, a biopharmaceutical company. It directly inhibits a virus's ability to replicate. It was made to fight the Ebola virus, has been shown in animal models to have some effect against the MERS and SARS virus, and in the lab, it looks like it can inhibit this coronavirus. Think of it like Tamiflu, the antiviral you can get if you have influenza. It doesn't prevent the illness, and it's not an instant cure, but it's likely to reduce how long you're sick for and get you healthy again faster. Remdesivir, based on everything we know, is a drug you would need to get through an IV and would be for hospitalized COVID-19 patients only. It's not a pill. Now, the NIH just released some preliminary data from the adaptive COVID-19 treatment trial. This is the first clinical trial for remdesivir in the United States, and the early news is promising. The trial involved a little over 1,000 patients and showed patients given remdesivir recovered 31% faster than those who didn't get it. It was a difference of 11 days versus 15. This is a step in the right direction. But on the other hand, another trial published in the medical journal The Lancet, looking at hospitalized patients in China, wasn't as promising. The researchers didn't see a big difference in patients receiving remdesivir versus those who weren't getting it. And the trial was even stopped early because of adverse side effects. But prior to this trial, researchers at the University of Chicago reported great news and said patients on remdesivir were getting better and leaving the hospital earlier than expected. The headlines can be confusing, and everyone is ready, so ready, for some good news. Now, data from this NIH trial is going to be released soon, and it has to be so that it can be peer-reviewed and scientists can better understand whom to give remdesivir to and better understand its safety profile. In the end, the FDA is reportedly going to give this drug the green light and authorization. So stay optimistic but realistic. Regardless of all the conflicting news reports, this is a step in the right direction.
I should also know that that could be a therapeutic, and there are also dozens of vaccine trials underway as well. So, of course, if there's any progress, we will report that. Also want to show you real quickly the list of activities now the state says are approved. Badminton, cycling, golf, that's a new one. Singles, though, rock climbing, And table tennis is another one, also in the form of singles. They don't list tennis specifically, although we're still trying to figure that out. And the big news is, although Orange County beaches are now off limits, Northern California beaches remain open. There was speculation over whether they'd be closed. Thanks for joining us today. Have a great rest of the day. Take care. All right, thanks for joining us on Facebook today, everybody. See you tomorrow.